Hello, and welcome to Nevada State High School's Student Health the College Year tutorial for all students. Use the guide bar at the bottom of the presentation to navigate through the presentation. Go ahead, click the forward button now to begin the presentation. During this tutorial, we will discuss student health and how to maintain it. We will look at physical health and discuss diet and exercise as a tool to maintain a healthy body. We will also look at mental and emotional health. We will discuss things you can do to maintain a healthy, well-rounded lifestyle while in college, as well as throughout your life. At the end of the presentation, you will take a 5-question quiz. Follow along closely and let's get started. Click to the next slide when you are ready. Health is derived from HALE, or whole, meaning health is part of your physical, mental, and emotional well-being. If you are not in top health, any of these 3 components could start to deteriorate. Living a healthy lifestyle is a commitment only you can make to yourself, because it is a commitment you must remake every day. Decide while you are young to be healthy and active for a longer, happier life. Click to the next slide when you are ready. You are what you eat, so let's begin by discussing diet. What you eat is important, but of equal importance is what you do not eat, how much you eat, and even when. Most of you know about the food pyramid and understand that you should be eating a balanced diet. Eat lots of fruit and vegetables, grains, and beans. Eat less meat and dairy, and even less sugar and fat. Potato chips do not count as a grain or vegetable. College students have a very bad habit of putting on 15 to 20 pounds during their freshman year. This is in large due to a lack of wholesome, nutritious foods, including their diet, as well as a lack of physical activity, which we'll discuss in a moment. Click to the next slide when you are ready. Eating a good balance of healthy foods is a good start, but here are a few simple tips to help you ensure you are putting the right things into your body. Number 1, drink plenty of water. When you are thirsty, do not pour sugar and salt into your body. Make sure you have enough water. It'll make you feel better, give you more energy, and save you money. Number 2, eat breakfast. Do not starve yourself at the beginning of the day. Take a moment, eat a muffin or a banana before heading out the door. You don't need to cook up a feast, just something healthy. Number 3, during the day, try to avoid snacking on only potato chips, soda, candy bars, grandma's cookies, and so on. Make snack time healthy. Number 4, have variety in your diet. When you are grocery shopping or going out to eat, don't be afraid to try new things. You never know what you might like. Make sure you are trying healthy items, not just a new ice cream flavor. Also, beware of peer pressure. You'll be living in an environment that does not always encourage these good habits. If you can find others who want to be healthy, you will help each other make better choices. Click to the next slide when you are ready. Dining hall meals are often scheduled in a rotation, meaning the options can get old. If you aren't proactive about being creative and switching it up, you could get very quickly tired of the food. The same goes for the salad bar and the healthy foods. Too many boring salads every night? You'll never want another one in your life. Think of the dining hall as a game. What's the most innovative meal you can create? If you use the same ideas we do at the massive casino buffets, you'll do perfect. Use the smaller plates so even if you do pile on the food, you have less area to fill. Check out all the options first before committing to any food. Remember, if you are paying to eat in the dining hall, most campuses let you visit the dining hall as often as you want each day, so make sure you are eating a small meal or snack every 4 to 6 hours. Click to the next slide when you are ready. Our society has become increasingly obsessed with weight and physical appearance, and more people have tried some sort of diet at one point or another. It is important to distinguish between normal dieting or body consciousness and eating disorders such as anorexia and bulimia. Often we hold ourselves to unrealistic ideas based on airbrushed magazines, fake billboards, and the wrong idea of what beautiful really means. Eating disorders often start in high school or college and affect both men and women. Click to the next slide when you are ready. Bulimia is a type of eating disorder. People with bulimia will eat a larger amount of food than most people would in a similar situation in a short period of time. They binge. Then, in order to prevent weight gain, they'll do something to get rid of the food. They purge. They may vomit, exercise too much, or use medicines like laxatives. People who have bulimia judge themselves harshly on their body weight and shape. In order to help them cope with these feelings, they follow a strict diet and try to lose weight. But over time, the hunger from the strict diet triggers them to binge eat. After binge eating, they feel out of control, ashamed, guilty, and afraid of gaining weight. This distress causes them to purge in hopes of undoing any possible weight gain from the binge. Without treatment, this cycle can lead to a serious long-term health problem. Acid in the mouth from vomiting can cause tooth decay, gum disease, and loss of tooth enamel. Any type of purging can lead to bone thinning or osteoporosis, kidney damage, heart problems, or even death. Click to the next slide when you are ready. People who have anorexia have an intense fear of gaining weight. They severely limit the amount of food that they can eat and can become dangerously thin. Anorexia affects both the body and the mind. It may start as dieting, but it often gets out of control. You think about food, dieting, and weight all the time. You have a distorted body image. Other people say you are too thin, but when you look in the mirror, you see your body as overweight. Anorexia usually starts in the teen years. It's much more common in females than males. Early treatment can be very effective. The earlier it is treated, the better the chances someone can recover from anorexia. Untreated anorexia can lead to the starvation and serious health problems such as bone thinning, kidney damage, and heart problems. Some people die from this problem. Click to the next slide when you are ready. Drinking is a major area of concern when discussing college students' health. There are some interesting statistics associated with college drinking, of which all students should be aware. According to the National Institute of Alcohol Abuse and Alcoholism, 4 out of 5 college students drink. In addition, half of those who do drink consume through binge drinking. The Institute defines binge drinking as a pattern of drinking that brings blood alcohol concentration levels to 0.09. This typically occurs after 4 drinks for women and 5 drinks for men in about 2 hours. In addition, just under 2,000 college students die each year from alcohol-related injuries that were unintentional. Alcohol-related assaults are just under 700,000 students. Sexual abuse is more than 97,000, and a quarter of college students report negative academic consequences from drinking. Remember, these numbers are based on reported or known incidences. How many more go unreported each year? Jail time, expulsion, fines, and alcoholism are just a few additional consequences for not dealing with alcohol responsibly. This is a serious issue, and peer pressure will only make it worse. Decide now how you are going to avoid situations that could possibly destroy your future. Click to the next slide when you are ready. Smoking is another area of concern when it comes to student health. The CDC reported that in 2012, 17.3% of adults ages 18 to 24 were smokers. While that number may not mean much, a third of college students are considered smokers. Smoking is the leading cause of preventable death in the United States. There are more than 480,000 deaths each year from smoking. Let's put this into perspective. For every 5 people that die annually, 1 of them is a smoker. Colleges have been making a large push to discourage smoking on campus. Americans for Non-Smokers' Rights reported that, as of October 1, 2014, 1,477 colleges were 100% smoke-free. 291 of these schools also prohibit e-cigarettes. If you currently smoke, you need to be aware of the serious health risks that are associated with your actions. There are numerous resources to help those of you who wish to quit. Click to the next slide when you are ready. Smoking has many nasty side effects, including the healthier teeth and gums and can cause tooth loss and cavities, diminished collagen in your skin causing wrinkles prematurely, blockages caused by smoking can also reduce blood flow to your legs and skin. Women who smoke have weaker bones than women who never smoked and are at a higher risk for broken bones. It can cause inflammation and adverse effects on the immune function, and can cause cancer in almost any part of the body. Not to mention, it makes you smell bad, your hair smell bad, your clothes, and costs a lot of money. Click to the next slide when you are ready. According to the CDC in 2010, 23% of young adults between the ages of 18 and 24 were considered obese. Adults need a minimum of 2.5 hours of exercise per week. That comes out roughly to 20 minutes per day, which is not too much time. If you balance your time wisely, make it a priority and schedule it, finding that time to exercise will not be hard. Just eating right is not enough for a healthy lifestyle. Remember our first slide. Health comes while all three are complete. Exercise is an essential part to that equation. Also, it does not need to be 20 minutes at the gym or on the track. You can make it fun, playing physical active games, or by doing something that you already enjoy, like hiking, swimming, jogging, yoga, or so on. Also, take a friend. Better yet, encourage someone else to have an active lifestyle, and you can support each other. Just being active is great. Take the stairs, walk or ride a bike if it's nice out. Find ways to get moving and enjoy it. Today's state-of-the-art student recreation centers make college gyms of old seem almost unrecognizable. The top university fitness centers compete on a level with the finest private clubs in the nation. In addition to devoting substantial space to equipment, weight machines, free weights, and the most modern university gyms also incorporate elements such as rock climbing, bouldering, sand volleyball, indoor tracks, whirlpools, saunas, golf simulators, Pilates, and martial arts studios, and more. Check out your campus's recreation center because the best part, if you're a full-time student, chances are you're already paying to use the facility. Click to the next slide when you are ready. Sleep is a necessary aspect of life and is essential to our health. It is recommended that we get 7 to 9 hours of sleep every night. Research suggests the benefits of sleep include sharpening your attention span, improving your memory, improving grades with help of the first two, controlling hunger, preventing illness, and lowering your risk of depression and anxiety. Click to the next slide when you are ready. Get an effective nap in 20 minutes or less. Sleep comes in a cycle of 5 stages. In stage 1 sleep, you are just drifting off. In stage 2, brain activity slows. Sleep stage 1 typically lasts 10 minutes, and stage 2 lasts another 10 minutes. The 20-minute nap allows most people to wake up feeling energized and more alert. Times will vary a little bit, so experiment to learn what best works for you. Also, keep naps to less than 30 minutes to prevent the onset of a deep sleep, which will make you feel groggy and tired. Nap between 1 p.m. and 3 p.m. when energy levels are at the lowest. Use a face mask or eye pillow to promote darkness for a quality nap. Avoid napping within 3 hours of bedtime, which can interfere with that nighttime sleep. Nap in a quiet place or use earplugs. And set an alarm or ask someone to wake you so you don't overnap. Click to the next slide when you are ready. If you want to get a better night of sleep, try washing your sheets once a week. Sprinkle your sheets and your pillowcases with lavender-infused water to relax. Have a second set of sheets available for ease of changing. Make sure your pillow supports your head and neck. Gently stretch before getting into bed. Turn off all electronics, yes, even your phone, at least 30 minutes before bedtime. Set your alarm earlier in the morning to keep you on a constant sleep schedule. And work out in the morning to improve nighttime sleep quality. Sleep research has shown that a 7 a.m. exercise time results in the best sleep. Click to the next slide when you are ready. Your mental health includes your emotional, sociological, and social well-being. It affects how we think, feel, and act. Your mental health helps determine how we handle stress, relate to others, and make choices. Click to the next slide when you are ready. Here are a few ideas to manage stress and your mental health. First, time management. Manage your time so you are not overbooked or spread too thin. Second, one thing at a time. Do not try and multitask. No one expects you to be perfect. Number 3, be realistic in all goals you set. Number 4, exercise. Number 5, take a break. You're in college and you're supposed to have fun. Number 6, share with friends. Use your friends as a support. And finally, be flexible. Life happens and sometimes we have no control over it. Click to the next slide when you are ready. It is important to know your limits. Everyone has limits. It's important to remember you can say no. No one expects you to be able to do it all and be perfect. When you have reached your limit, start telling people no. Never forget to take any medicine prescribed to you by your doctor. There are many apps you can download to help remind you as well. There's no shame in taking any medicine from your doctor, so do not be embarrassed by this. You can also take medication in your dorm room for more privacy. Knowing your limits can prevent you from becoming wiped out and at a weak point where your mental and emotional health could be affected. Click to the next slide when you are ready. Anxiety disorders are the most common mental illness in the United States, affecting approximately 1 in 9 people at any given time, according to the National Institute of Mental Health. Fortunately, it is possible to manage anxiety with counseling and/or medication. Click to the next slide when you are ready. There are different types of anxiety disorders: phobias, panic attacks, obsessive-compulsive disorder, post-traumatic stress disorder, or PTSD, to name a few. Click to the next slide when you are ready. Colleges are designed to be very challenging academically, personally, and socially. Some anxiety is a natural byproduct of the accelerated pace of learning and growth. Everyone feels anxious in certain situations, but anxiety disorders can make it very difficult for students to function. One key sign of an anxiety disorder is nervousness that is impossible to control or out of proportion to what's going on. For some people, anxiety can feel so overwhelming that their ability to work, study, interact with people, or follow a daily routine is affected. Some important signs and symptoms to watch for include intense episodes of fear or panic, reoccurring nightmares, avoidance of social situations, difficulty concentrating, repeated or unwanted thoughts or obsessions, sleep disturbances, upsetting or intrusive memories of a traumatic event, physical symptoms such as nausea, stomach pain, rapid heart rate, muscle tension, sweating, shaking, dizziness, numbness, or even a difficulty breathing. If you feel you are suffering from anxiety, it is important to seek help. Take advantage of the health resources and counselors available at your school. Click to the next slide when you are ready. Depression can affect a person's ability to work, study, interact with people, or take care of themselves. The symptoms of depression can last months to years if untreated. Depression isn't always easy to spot. It may be expressed through the abuse of drugs and alcohol or hostile, aggressive, and at-risk behavior. Many factors can contribute to the onset of depression, including the persistence of other emotional distresses, disorders, poor nutrition, physical illness, personal loss, and relationship difficulties. Not everyone experiences depression in the same way. Some people may experience primarily behavioral changes, some mainly emotional changes, and still others mostly physical changes. Click to the next slide when you are ready. You should know, depression affects about 19 million people in the U.S. every year, and 1 in 5 at some point in their lifetime. According to the American College of Health Association's National College Health Assessment, the rate of students reporting ever being diagnosed with depression increased 56% from 2000 to 2005. The majority, 80 to 90% of people who receive treatment for depression experience significant improvement, and almost all individuals gain some relief from their symptoms. Click to the next slide when you are ready. Some signs and symptoms of depression could include persistently sad, anxious, irritable, or empty mood, a loss of interest in previously enjoyable activities, withdrawal from friends and family, trouble sleeping or sleeping too much, feeling tired or run down, significant change in appetite and or weight, anger and rage, overreaction to criticism, feeling unable to meet expectations, difficulty thinking, concentrating, remembering, or making decisions, feeling restless or agitated, feelings of worthlessness, hopelessness, or guilt, persistent physical symptoms such as headaches, digestive problems, or chronic pains that do not respond to routine treatment, substance abuse problems, or recurrent thoughts of death or suicide. If you think you might be suffering from depression or know someone else who might be, seek help. Go talk to a counselor or see a doctor right away. Click to the next slide when you are ready. Cutting is the act of intentionally inflicting harm on oneself, usually without suicidal intent. While cutting may occur on any part of the body, it is most common on the hands, wrists, stomach, and thighs. Not everyone who cuts does so for the same reasons. Some people report overwhelming sadness, anxiety, or emotional numbness to be common triggers. Other reasons include a need to feel in control, relieve stress, create visible and treatable wounds, purify one's body, and reenact a trauma in an attempt to resolve it or shield others from one's emotional pain. Click to the next slide when you are ready. Cutting often begins between the ages of 12 and 15, but studies suggest that 30 to 40% of college students who cut began at 17 years or older. Because cutting often occurs in private, it is difficult to gauge how commonly cutting occurs. It is estimated that cutting occurs anywhere between 4 and 38% of the population. An estimated 25 to 40% of those people who cut also have an eating disorder. Click to the next slide when you are ready. Over 1/3 of the respondents in a college study who reported cutting indicated that no one knew about the behavior. Studies have shown that individuals with a history of cutting are over 9 times more likely to report suicide attempts and nearly 6 times more likely to report having a suicide plan. Click to the next slide when you are ready. Here are a few things to watch for. Unexplained burns, cuts, bruising, scars, healing or healed wounds, or similar markings on the skin, constantly wearing long sleeves or pants in the summer, a constant use of wristbands, large watch bands, or large bracelets, and frequent bandages or other methods of covering wounds. If you think you might be cutting or know someone else who might be, it is important to seek help. Go talk to a counselor or see a doctor right away. Click to the next slide when you are ready. Suicide can be prevented. Most people who feel suicidal give definite warning signs, but those close to them are often unaware of these signs or what to do about them. Most suicidal people desperately want to live but are unable to find other ways to cope with their thoughts and feelings. Almost all college students who die by suicide are suffering from an emotional disorder, most commonly depression. Other emotional problems can also increase the risk for suicide, including anxiety disorders, bipolar disorder, substance abuse, or eating disorders. Identifying and treating these illnesses is especially important because someone with an untreated emotional problem may be more likely to attempt suicide in the wake of a stressful event, such as a death, a relationship problem, or a failed exam. Click to the next slide when you are ready. The most effective way to prevent suicide is to know the warning signs, take those signs seriously, and know how to respond when you experience them yourself or see them in a friend or a classmate. The important thing is to remember that there is hope and there is effective available treatment for people who are suicidal. The National Suicide Prevention Lifeline at 1-800-273-8255 or TALK is available always. If you think any of your friends could be suicidal, tell someone immediately. In this case, you would rather have your friend be mad at you for saying something than succeed in taking their own life. Once they receive the help they need, they will be happy to have a friend like you. Once again, 1-800-273-8255. Click to the next slide when you are ready. Common warning signs to look for include hopelessness, rage, uncontrollable anger, revenge, acting reckless or engaging in risky activities seemingly without thinking, feeling trapped like there's no way out, and increased alcohol or drug use. Click to the next slide when you are ready. Other warning signs could include withdrawing from friends, family, and society, anxiety, agitation, unable to sleep or sleeping all the time, dramatic mood changes, and expressing no reason for living or no sense of purpose in life. Click to the next slide when you are ready. Suicide is the second leading cause of death among college students. Nearly 4,000 people aged 15 through 24 die by suicide each year in the United States. 7% of college students say that they have seriously considered suicide during the past year. 16% of students say that they have had a friend who has talked about wanting to end their life in the past year. Click to the next slide when you are ready. You are now ready to begin the Achievement Planner. Click to the next slide when you are ready. This planner may be used weekly or monthly as you see fit. The goal of the Achievement Planner is to help you prioritize yourself and more specifically, how you will focus on staying healthy. The main topics are set to make sure that you are eating right, exercising, relaxing, and having fun. Start using this planner now and for the rest of high school so it becomes routine in college. Click to the next slide when you are ready. Use this time to complete the Achievement Planner for the rest of April. Remember, this planner is for your physical, mental, and emotional health. If it helps with academics, great, but that is not the focus of this activity. Click to the next slide when you are ready. It's a done deal. We've completed the presentation for student health, the college years. You now have valuable information about how important it is to maintain a healthy lifestyle, keep a balanced life, and when to slow down and seek help. Now let's take a short 5-question quiz on your understanding of the tutorial. Click to the next slide when you are ready. Let's go through a couple of things before you begin your 5-question quiz, including number 1. After answering each question, click Next. Number 2. After answering all the questions from the quiz, click Submit All. Number 3. You will have only 2 opportunities to take the quiz and earn as many points as possible. Number 4. The quiz is worth a total of 50 points. Take your time and read each question carefully. Click to the next slide when you are ready to begin.